Question 1. A 45-year-old patient with a family history of breast cancer presents with a palpable lump in the left breast. The mammogram reveals a spiculated mass. What is the next best diagnostic step? A. Fine needle aspiration. B. Core needle biopsy. C. Repeat mammogram. D. MRI of the breast. Answer: B. Core needle biopsy. Rationale: core needle biopsy is the gold standard for tissue diagnosis when a suspicious mass is identified on mammography. Fine needle aspiration can miss some cancers, and a repeat mammogram or MRI may delay the diagnosis. Question 2. A patient with stage 3 invasive ductal carcinoma, IDC, is scheduled for neoadjuvant chemotherapy. What is the main goal of this therapy in this stage? A. To cure the cancer. B. To reduce tumor size for surgery. C. To prevent recurrence. D. To improve survival rates. Answer: B. To reduce tumor size for surgery. Rationale: neoadjuvant chemotherapy is used to shrink the tumor and make it more operable, not to cure or improve survival in this stage. It also helps in assessing the tumor's response to chemotherapy. Question 3. A patient with breast cancer has a HER2-positive tumor. Which treatment is most likely to be effective for this patient? A. Tamoxifen. B. Aromatase inhibitors. C. Trastuzumab Herceptin. D. Radiation therapy. Answer: C. Trastuzumab Herceptin. Rationale: Trastuzumab Herceptin is targeted therapy used for HER2-positive breast cancer, as it directly inhibits the HER2 receptor. Tamoxifen and aromatase inhibitors are used for estrogen receptor-positive cancers, and radiation therapy is not a targeted treatment for HER2-positive tumors. Question 4. What is the most important factor in determining whether a breast cancer patient is a candidate for breast-conserving surgery? A. Tumor size. B. Tumor location. C. Lymph node involvement. D. Estrogen receptor status. Answer: B. Tumor location. Rationale: tumor location is crucial in determining whether breast-conserving surgery is feasible. The tumor should be localized and not involve multiple quadrants or be near the chest wall. Tumor size and estrogen receptor status play roles, but are secondary to location. Question 5. A 58-year-old patient with stage I estrogen receptor-positive breast cancer is post-surgery. What is the most effective post-treatment therapy to reduce recurrence? A. Tamoxifen. B. Chemotherapy. C. Aromatase inhibitors. D. Radiation therapy. Answer: C. Aromatase inhibitors. Rationale: aromatase inhibitors are the preferred adjuvant therapy for postmenopausal women with estrogen receptor-positive breast cancer. Tamoxifen is used for premenopausal women. Chemotherapy is reserved for higher stages, and radiation is not the first line in early-stage cancer. Question 6. A patient with a history of breast cancer treatment develops severe fatigue and muscle weakness. Which of the following could be a long-term side effect of breast cancer therapy? A. Neuropathy. B. Osteoporosis. C. Arrhythmias. D. Liver failure. Answer: B. Osteoporosis. Rationale: osteoporosis is a well-documented long-term side effect of breast cancer therapies, especially with the use of aromatase inhibitors and chemotherapy. Neuropathy can occur, but it is not as common in breast cancer treatments. Arrhythmias and liver failure are not typically linked with breast cancer therapies. Question 7. A patient undergoing mastectomy with axillary lymph node dissection presents postoperatively. What is the priority nursing intervention to prevent complications in the immediate postoperative period? A. Administer pain medication. B. Elevate the affected arm. C. Monitor for signs of infection. D. Assess for hematoma formation. Answer: B. Elevate the affected arm. Rationale: elevating the affected arm is crucial to reduce the risk of lymphedema after axillary node dissection. pain management, infection monitoring, and hematoma assessment are also important, but secondary to preventing lymphedema. Question 8. A 47-year-old patient diagnosed with stage 3 breast cancer is considering genetic testing for BRCA1 and BRCA2 mutations. What is the most appropriate nursing intervention? A. Inform the patient that testing is mandatory for all breast cancer patients. B. Discuss the implications of genetic testing and refer for genetic counseling. C. Proceed with genetic testing without discussing with the patient. D. Advise the patient to decline testing to avoid potential anxiety. Answer. B. Discuss the implications of genetic testing and refer for genetic counseling. Rationale. It is important to discuss the implications of genetic testing and refer to a genetic counselor who can provide comprehensive information. Testing should not be mandatory, and the decision should be patient-centered. Question 9. A patient undergoing chemotherapy for breast cancer reports severe nausea. Which of the following is the most appropriate intervention? A. Administer antiemetics as prescribed. B. Encourage the patient to eat foods they enjoy. C. Increase fluid intake to prevent dehydration. D. Suggest rest and avoid activity. Answer. A. Administer antiemetics as prescribed. Rationale. Antiemetics are essential for managing chemotherapy-induced nausea. Encouraging food intake and increasing fluids are helpful but secondary. Resting is important, but the primary intervention is pharmacological management. Question 10. A patient with breast cancer presents with signs of bone metastasis. What is the most appropriate imaging modality to confirm the diagnosis? A. X-ray of the chest. B. Bone scan. C. CT scan of the abdomen. D. MRI of the brain. Answer. B. Bone scan. Rationale. A bone scan is the most sensitive imaging modality for detecting bone metastasis in breast cancer. X-rays, CT scans, and MRIs are used in specific cases, but are not as sensitive for detecting bone involvement. Question 11. Which of the following is a common psychological response to a breast cancer diagnosis that nurses should anticipate? A. Denial of the disease. B. Immediate acceptance of the prognosis. C. Anger and frustration with treatment. D. Impulsive decision-making regarding treatment. Answer. C. Anger and frustration with treatment. Rationale. Anger and frustration are common emotional responses as patients process the implications of their diagnosis and treatment. Denial, acceptance, and impulsivity are less frequent and may occur in certain individuals, but are not as common. Question 12. Which of the following factors is most likely to indicate a poor prognosis for a patient with breast cancer? A. Small tumor size. B. Negative estrogen receptor status. C. Absence of lymph node involvement. D. Well-differentiated tumor. Answer. B. Negative estrogen receptor status. Rationale. A negative estrogen receptor status is a strong indicator of a poor prognosis, as hormone therapies are less effective. Smaller tumor size, absence of lymph node involvement, and well-differentiated tumors are generally favorable prognostic factors. Question 13. A 65-year-old woman with breast cancer has been prescribed tamoxifen. Which potential side effect of tamoxifen should the nurse monitor for? A. Osteoporosis. B. Deep vein thrombosis, DVT. C. Weight loss. D. Alopecia. Answer. B. Deep vein thrombosis, DVT. Rationale. Tamoxifen increases the risk of venous thromboembolism, including deep vein thrombosis, DVT. Osteoporosis is a risk with aromatase inhibitors, but tamoxifen does not typically cause weight loss or alopecia. Question 14. A patient undergoing breast cancer treatment expresses difficulty swallowing. Which of the following interventions is most appropriate? A. Encourage oral hygiene with alcohol-based mouthwash. B. Recommend frequent sips of warm water. C. Provide soft foods and avoid spicy foods. D. Administer systemic analgesics for pain relief. Answer: C. Provide soft foods and avoid spicy foods. Rationale: soft foods and avoiding irritants like spicy foods can help manage mucositis. Alcohol-based mouthwashes can further irritate the mucous membranes, and systemic analgesics should be used cautiously for pain relief. Question 15. After completing radiation therapy for breast cancer, what is a priority for the nurse to assess in the patient? A. Pain management. B. Skin irritation or burns. C. Signs of infection. D. Cardiovascular function. Answer: B. Skin irritation or burns. Rationale: skin irritation or burns are common side effects of radiation therapy, and the nurse must assess the skin condition to prevent further damage. Pain management and infection monitoring are important, but secondary to skin care. Question 16. A patient receiving adjuvant chemotherapy for breast cancer asks about the risk of cancer recurrence. What is the nurse's best response? A. There is a high risk of recurrence, so you will need continuous treatment. B. The risk of recurrence is minimal with chemotherapy, and you should not worry. C. Chemotherapy reduces the risk of recurrence, but you must continue regular follow-up care. D. Recurrence is unlikely if you follow the prescribed treatment exactly. Answer: C. Chemotherapy reduces the risk of recurrence, but you must continue regular follow-up care. Rationale: chemotherapy reduces the risk of recurrence, but does not eliminate it entirely. Regular follow-up care is necessary for ongoing monitoring and early detection of any recurrence. Question 17. A 40-year-old patient presents with a family history of breast cancer and asks about genetic testing. What is the nurse's primary role in this situation? A. Recommend immediate testing for all patients with a family history. B. Provide general information about BRCA testing and refer for genetic counseling. C. Disregard the family history as a factor in testing recommendations. D. Suggest that genetic testing is unnecessary for patients under 50. Answer: B. Provide general information about BRCA testing and refer for genetic counseling. Rationale: the nurse should provide information about BRCA testing and refer the patient to a genetic counselor for comprehensive counseling and assessment. Immediate testing is not appropriate without proper evaluation. Question 18. A patient undergoing breast cancer treatment expresses feelings of hopelessness. What is the best intervention to address these feelings? A. Reassure the patient that everything will be fine. B. Offer emotional support and encourage counseling. C. Distract the patient with light conversation. D. Suggest focusing on positive thoughts only. Answer: B. Offer emotional support and encourage counseling. Rationale: offering emotional support and referring for counseling can help address feelings of hopelessness. Reassurance and distractions may be helpful, but they should not replace addressing the patient's emotional needs. Question 19. A patient undergoing chemotherapy for breast cancer experiences mucositis. What is the most effective nursing intervention? A. Encourage oral hygiene with alcohol-based mouthwash. B. Recommend frequent sips of warm water. C. Provide soft foods and avoid spicy foods. D. Administer systemic analgesics for pain relief. Answer: C. Provide soft foods and avoid spicy foods. Rationale: soft foods and avoiding irritants like spicy foods can help manage mucositis. Alcohol-based mouthwashes can further irritate the mucous membranes, and systemic analgesics should be used cautiously for pain relief. Question 20. A patient with breast cancer asks about the role of lifestyle changes in reducing the risk of recurrence. What should the nurse emphasize? A. Maintaining a high-fat diet and reducing exercise. B. Engaging in regular physical activity and maintaining a healthy weight. C. Reducing fluid intake to avoid fluid retention. D. taking antioxidant supplements to prevent recurrence. Answer: B. Engaging in regular physical activity and maintaining a healthy weight. Rationale: regular physical activity and maintaining a healthy weight are evidence-based strategies that can help reduce the risk of recurrence. A high-fat diet, fluid restriction, and antioxidant supplements are not effective in reducing recurrence risk. Question 21. A 50-year-old patient presents with a palpable breast mass and nipple discharge. The mammogram shows a mass with microcalcifications. What is the next most appropriate step in diagnosis? A. Repeat mammogram in 6 months. B. Core needle biopsy. C. Surgical excision of the mass. D. Fine needle aspiration. Answer: B. Core needle biopsy. Rationale: core needle biopsy is the gold standard for obtaining a tissue diagnosis, especially when microcalcifications are present, as they can indicate malignancy. Fine needle aspiration may not provide sufficient tissue for analysis. Surgical excision is premature without a diagnosis. Question 22. A patient with breast cancer has a tumor that is estrogen receptor positive, HER2 negative, and has 3 positive axillary lymph nodes. Which of the following treatments is most likely to improve survival in this patient? A. Tamoxifen alone. B. Combination chemotherapy and radiation therapy. C. Trastuzumab, Herceptin, and chemotherapy. D. Aromatase inhibitors and radiation therapy. Answer: B. Combination chemotherapy and radiation therapy. Rationale: for a patient with positive lymph nodes and hormone receptor-positive breast cancer, combination chemotherapy with radiation therapy improves survival. Tamoxifen alone is not sufficient for this stage, and trastuzumab is not indicated in HER2 negative cancers. Question 23. A patient undergoing chemotherapy for breast cancer develops neutropenia. Which of the following interventions is most appropriate to prevent infection? A. Place the patient in isolation. B. Administer granulocyte colony stimulating factor, GCSF. C. Increase the patient's fluid intake. D. Encourage frequent physical activity. Answer: B. Administer granulocyte colony stimulating factor, GCSF. Rationale: GCSF stimulates the production of neutrophils and reduces the risk of infection in neutropenic patients. Isolation is not necessary unless infection is suspected. Increased fluid intake and physical activity do not directly address neutropenia. Question 24. A 55-year-old postmenopausal woman with breast cancer has been prescribed an aromatase inhibitor. Which of the following is the most concerning side effect of this treatment? A. Hyperkalemia. B. Osteoporosis. C. Weight gain. D. Nausea and vomiting. Answer: B. Osteoporosis. Rationale: aromatase inhibitors lower estrogen levels, increasing the risk of osteoporosis. Hyperkalemia, weight gain, and nausea are not common side effects associated with aromatase inhibitors. Question 25. A patient presents with inflammatory breast cancer. Which of the following is the most appropriate first-line treatment? A. Mastectomy. B. Neoadjuvant chemotherapy. C. Radiation therapy. D. Hormone therapy. Answer: B. Neoadjuvant chemotherapy. Rationale: inflammatory breast cancer is aggressive and usually requires neoadjuvant chemotherapy to reduce the tumor burden before surgery. Mastectomy, radiation, and hormone therapy are used later in the treatment plan. Question 26. A patient with metastatic breast cancer is receiving palliative care. Which of the following interventions is most appropriate to manage pain? A. Administer acetaminophen regularly. B. Encourage relaxation techniques. C. Provide opioid analgesics as prescribed. D. Recommend non-pharmacological therapies only. Answer: C. Provide opioid analgesics as prescribed. Rationale: opioid analgesics are the cornerstone for managing cancer pain. especially in metastatic disease. Acetaminophen may be insufficient, and non-pharmacological therapies are adjuncts rather than primary treatments in this setting. Question 27. A postmenopausal patient with breast cancer is prescribed tamoxifen. What is the most critical nursing consideration when administering this medication? A. Monitor for signs of infection. B. Monitor for deep vein thrombosis, DVT. C. Encourage adequate hydration. D. Monitor for signs of liver failure. Answer: B. Monitor for deep vein thrombosis, DVT. Rationale: tamoxifen increases the risk of thromboembolic events, including DVT. Monitoring for infection, hydration, and liver failure are not primary concerns for tamoxifen therapy. Question 28. A patient with breast cancer is found to have a tumor with high expression of Ki-67. What does this indicate about the tumor? A. The tumor is slow-growing and less aggressive. B. The tumor has a high rate of cell division and is likely aggressive. C. The tumor is estrogen receptor positive. D. The tumor is likely to respond well to chemotherapy. Answer: B. The tumor has a high rate of cell division and is likely aggressive. Rationale: Ki-67 is a marker of cell proliferation. High expression indicates a high rate of cell division, suggesting the tumor is aggressive. Estrogen receptor status and chemotherapy response are not directly indicated by Ki-67 expression. Question 29. A 45-year-old woman diagnosed with breast cancer has a BRCA1 mutation. What is the most appropriate next step in her care? A. Begin chemotherapy immediately. B. Discuss prophylactic mastectomy and ovarian removal. C. Start hormone therapy. D. Perform genetic counseling for family members. Answer: B. Discuss prophylactic mastectomy and ovarian removal. Rationale: BRCA1 mutations significantly increase the risk of breast and ovarian cancer, and prophylactic surgery may be appropriate to reduce this risk. Chemotherapy, hormone therapy, and family counseling are important, but come after the discussion of risk-reducing surgeries. Question 30. A patient with breast cancer is being treated with trastuzumab, Herceptin. What is the most important nursing assessment prior to administering this medication? A. Assess for signs of heart failure. B. Monitor blood glucose levels. C. Check liver function tests. D. Assess for signs of deep vein thrombosis. Answer: A. Assess for signs of heart failure. Rationale: trastuzumab Herceptin can cause cardiac toxicity, including heart failure, so it is important to assess heart function before administering this medication. Other assessments, such as glucose levels and liver function, are not as critical in this case. Question 31. A patient diagnosed with metastatic breast cancer has liver metastasis. Which of the following is the most likely complication of liver involvement? A. Bleeding complications. B. Respiratory failure. C. Sepsis. D. Bowel obstruction. Answer: A. Bleeding complications. Rationale: liver metastasis can impair the liver's ability to produce clotting factors, increasing the risk of bleeding. Respiratory failure, sepsis, and bowel obstruction are not directly related to liver metastasis in this context. Question 32. A 35-year-old patient with early-stage breast cancer asks about the role of fertility preservation before chemotherapy. What is the most appropriate nursing response? A. Fertility preservation is not necessary, as chemotherapy rarely affects fertility. B. Fertility preservation is an option, but you must decide before starting chemotherapy. C. Chemotherapy is guaranteed to affect your fertility, so preservation is essential. D. You should wait until after chemotherapy to discuss fertility preservation. Answer: B. Fertility preservation is an option, but you must decide before starting chemotherapy. Rationale: chemotherapy can affect fertility, and fertility preservation methods, such as egg or embryo freezing, should be discussed before treatment starts. Waiting until after chemotherapy may limit options. Question 33. A patient with breast cancer who has completed chemotherapy is scheduled for radiation therapy. What is the primary goal of radiation in this patient? A. To shrink the tumor before surgery. B. To prevent recurrence of cancer. C. To relieve pain caused by bone metastasis. D. To treat systemic disease. Answer: B. To prevent recurrence of cancer. Rationale: radiation therapy is commonly used after surgery to kill any remaining cancer cells and reduce the risk of recurrence, particularly in the breast or chest wall. It is not used for systemic disease or pain management. Question 34. A patient with advanced breast cancer is experiencing fatigue, weight loss, and cachexia. Which of the following interventions should be prioritized? A. Administering appetite stimulants. B. Ensuring adequate pain control. C. Providing emotional support and counseling. D. Encouraging high-protein, calorie-dense meals. Answer: D. Encouraging high-protein, calorie-dense meals. Rationale: in patients with cachexia, nutrition is crucial to maintain body mass and strength. High-protein, calorie-dense meals help prevent further weight loss. Pain control, emotional support, and appetite stimulants are also important, but secondary. Question 35. A 48-year-old woman with breast cancer has completed radiation therapy. She is now experiencing persistent erythema and peeling of the skin over the treated area. What is the most appropriate intervention? A. Apply ice packs to the area. B. Use a corticosteroid cream as prescribed. C. Suggest sun exposure to promote healing. D. Recommend a stronger pain medication. Answer: B. Use a corticosteroid cream as prescribed. Rationale: skin irritation from radiation can be treated with topical corticosteroid creams to reduce inflammation and promote healing. Ice packs and sun exposure can worsen the skin condition, and stronger pain medication is not the first line of treatment. Question 36. A patient with breast cancer undergoing treatment with doxorubicin is at risk for which of the following complications? A. Heart failure. B. Pulmonary embolism. C. Gastrointestinal bleeding. D. Neutropenia. Answer: A. Heart failure. Rationale: doxorubicin is a chemotherapy agent that is associated with cardiotoxicity and can lead to heart failure. Pulmonary embolism, gastrointestinal bleeding, and neutropenia are not directly caused by doxorubicin. Question 37. A patient with breast cancer has a significant family history of cancer. What is the most appropriate recommendation for her at this time? A. Immediate bilateral mastectomy. B. Genetic testing for BRCA mutations. C. Chemoprevention with tamoxifen. D. Regular mammograms starting at age 40. Answer: B. Genetic testing for BRCA mutations. Rationale: genetic testing for BRCA mutations is indicated for patients with a strong family history of breast cancer to determine if they are at high risk for hereditary cancer. Immediate surgery or chemoprevention is premature without genetic confirmation. Question 38. A patient with advanced breast cancer is undergoing treatment with palbociclib Ibrance. What is the most important monitoring parameter for this patient? A. Liver function tests. B. Renal function tests. C. Complete blood count (CBC). D. Electrolyte levels. Answer: C. Complete blood count (CBC). Rationale: palbociclib Ibrance is a CDK4/6 inhibitor that can cause neutropenia, so it is important to monitor the CBC regularly. Liver and renal function tests, as well as electrolyte levels, are not primary concerns with palbociclib treatment. Question 39. A patient diagnosed with breast cancer is experiencing a metastatic tumor in the brain. Which of the following treatments is most likely to provide symptom relief? A. Chemotherapy. B. Radiation therapy. C. Hormone therapy. D. Surgery. Answer: B. Radiation therapy. Rationale: radiation therapy is effective for managing brain metastases from breast cancer by reducing tumor size and alleviating symptoms such as headaches and neurological deficits. Chemotherapy, hormone therapy, and surgery are not as effective for brain metastasis in this case. Question 40. A patient undergoing breast cancer treatment asks about the role of diet in managing treatment side effects. Which of the following is the most appropriate nursing recommendation? A. Follow a high-fat diet to maintain energy. B. Limit fluid intake to avoid bloating. C. Eat small, frequent meals to combat nausea. D. Avoid protein-rich foods to reduce fatigue. Answer: C. Eat small, frequent meals to combat nausea. Rationale: eating small, frequent meals can help manage chemotherapy-induced nausea and maintain nutritional intake. A high-fat diet, fluid restriction, and avoiding protein-rich foods are not beneficial for managing treatment side effects. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!